If you're between 50 and 70 and your morning erections have disappeared, listen carefully. Mayo Clinic researchers discovered that men who lose their morning wood face a 50-fold higher risk of heart attack within 3 to 5 years, and younger men are at the highest risk. Tonight, before you go to bed, I'm going to teach you a 60-second test that could literally save your life by revealing hidden heart disease before it's too late. I'm Dr. Eva Cole, and I specialize in men's health issues that most men are too embarrassed to discuss with their doctor. Here's what you need to understand. What's happening to you is extremely common. Over 50% of men over 50 experience some form of erectile dysfunction. But more importantly, it's not just about sex. Your erection quality, especially your morning erections, is a direct window into your cardiovascular health. In the next few minutes, you're going to learn exactly why this connection exists, the simple test you can do tonight to assess your risk, and most importantly, what you can do about it starting right now. This isn't about shame, it's about survival. Let me explain something most doctors never tell their patients. The blood vessels in your penis are only 1 to 2 millimeters wide. Compare that to the arteries in your heart, which are 3 to 4 millimeters, or the carotid arteries in your neck at 5 to 7 millimeters. Here's why this matters. When cholesterol and plaque start building up in your blood vessels, a process called atherosclerosis, it happens pretty evenly throughout your entire body, but the smallest blood vessels get blocked first. Think of it like this. Imagine water flowing through pipes in your house. If those pipes start getting clogged with buildup, the narrowest pipes will show problems first, while the bigger pipes might still seem fine. That's exactly what's happening in your body. Your penis is the early warning system because those tiny blood vessels get blocked 3 to 5 years before you experience any heart symptoms. Johns Hopkins research found that men in their 40s with erection problems, but no other risk factors, run an 80% risk of developing heart problems within 10 years. The medical community actually calls erectile dysfunction the canary in the coal mine for cardiovascular disease. Just like coal miners used to bring canaries down into mine shafts to warn them of dangerous gases, your penis is warning you about what's happening in your heart. Now here's the practical part, the test you can do tonight. This is based on what urologists use to distinguish between psychological ED and vascular ED. Tonight before bed, ask yourself these 3 questions. Question number 1, when was the last time you woke up with a morning erection? If it's been weeks or months, that's a red flag. Question number 2, can you still get erections with stimulation, pills, physical touch, but they're not as firm as they used to be, and you never wake up with them anymore? Question number 3, do you have a family history of heart disease, parents or siblings who had heart attacks before age 60? Here's what doctors know. Healthy men typically get 3 to 5 erections every single night during REM sleep. These nocturnal erections have nothing to do with sexual dreams. They're your body's natural way of exercising the blood vessels and keeping tissue healthy. Morning wood is just you waking up during one of these natural cycles. If you answered yes to questions 2 and 3 and you can't remember your last morning erection, you need to treat this as a cardiovascular emergency, not just a bedroom problem. This is your body sending you a telegram saying, check your heart now. Let me share some data that should wake you up, literally. A Mayo Clinic study followed 1,400 men for 10 years. The men who developed new erectile dysfunction for the first time faced dramatically increased cardiac risk. For men in their 40s to early 50s, the relative risk of a major cardiac event, heart attack, sudden death, emergency room visits for chest pain, was 50 times higher compared to men without ED. 50 times higher. Let that sink in. Even more sobering, researchers found that ED symptoms appear an average of 3 to 5 years before the first heart attack. That means right now, if you're experiencing these changes, you have a window of opportunity to prevent a potentially fatal cardiac event. Now I want to address something important. Not all erection problems predict heart disease. If you're a younger man dealing with performance anxiety, stress, or relationship issues, and you still get strong morning erections, that's different. That's psychological, not vascular. The type of ED that predicts heart problems is when you have no morning wood, weaker erections even with stimulation, and especially if you have risk factors like high blood pressure, diabetes, smoking, or family history. Let me explain the mechanism so you understand this isn't just correlation, it's causation. Healthy erections require something called endothelial function. The endothelium is the lining of your blood vessels. When it's healthy, it produces nitric oxide, which causes blood vessels to relax and fill with blood. That's how you get an erection. When you develop endothelial dysfunction, usually from high cholesterol, high blood pressure, diabetes, or smoking, your blood vessels can't relax properly anymore. The small vessels in your penis fail first, but the same process is happening in your heart, your brain, everywhere. Here's the crucial point. Erectile dysfunction isn't just a sex problem, it's endothelial dysfunction. It's a whole body vascular disease that's showing up in your penis first because those blood vessels are the smallest and most sensitive. The good news? The same lifestyle changes that improve your erections also protect your heart. And studies show men who take this seriously and make changes can reverse early-stage vascular damage. Let's quickly review what we covered because this is life or death important. First, your penis is an early warning system. Loss of morning erections, especially combined with weaker sexual function, is a red flag for cardiovascular disease 3 to 5 years before heart symptoms appear. Second, the 60-second test. Ask yourself about morning erections, quality of erections with stimulation, and family history. If you're not getting morning wood and you have risk factors, this is urgent. Third, this isn't psychological if you have no morning erections at all. It's vascular, and it means the same blood vessel damage is happening in your heart. Fourth, you have a window of opportunity right now to prevent a heart attack. Here's what I want you to do right now, not tomorrow, not next week. Call your doctor and schedule 2 appointments. First, see your primary care doctor for a complete cardiovascular workup, cholesterol panel, blood pressure check, blood sugar, and discuss your family history. Second, ask for a referral to a cardiologist if you have multiple risk factors. Tell them specifically, I've lost my morning erections and I'm concerned about cardiovascular disease. Do not let them brush this off as just getting older. It's not. It's a medical emergency masquerading as a bedroom problem. If this information just connected the dots for you about symptoms you've been ignoring, click that like button right now so this video reaches more men who need to see it. Erectile dysfunction is something men suffer in silence about, and that silence is literally killing us. Subscribe to this channel because next week I'm covering the 5 foods that damage your blood vessels and kill your erections, and 3 of them are probably in your kitchen right now. Drop a comment below and tell me, when did you first notice changes in your morning erections? Let's break the stigma and start an honest conversation. And if you want to know the #1 supplement that doctors prescribe for cardiovascular health that also improves erectile function, watch the next video. It's not what you think. Remember, your body is trying to tell you something important. Don't ignore the warning signs. Take action today, and you could add years to your life. This is Dr. Eva Cole reminding you that your health matters and it's never too late to make a change.